Now, I want to ask you something to do with the profession generally.
Yeah.
I don't know whether you have any idea how this profession came to be in Kenya.
No, I don't know that history about our profession.
Okay, my name's Ruben Mwaso, and I'm currently the director of North Coast Medical Training College. And we have had a few days of planning, and now we have set off on a journey of more than 2,000 kilometers to try and document evidence and histories about what the clinical officers are doing in the field. Clinical officers began as helpers, and some say they started off as nurses who are given some extra clinical skills to be able to diagnose patients. So clinical officers have come in handy because they have a shorter training period of 3 years and 1 year of internship, which is shorter compared to about 7 years that doctors take.
In the year from 1954 to 58, I trained as a hospital assistant.
Yeah.
When I qualified, I worked in Kenyatta National Hospital for at least 2 years. Then I came to Tambach, which is my home district, and started working as a medical assistant. Now, first of all, our training was called hospital assistant. This was so because during the colonial days, there were very few doctors, and they had to train hospital assistants to assist the doctors. I mean, most of the medical people were doctors from overseas.
Okay.
So they started a training at Medical Training Center, Nairobi, called MTC.
Yes,
In Nairobi. It's during the year 1960 is when they changed the name from hospital assistant
to medical
to medical assistant.
Okay.
Now, as medical assistants, when independence came, most European doctors left the country,
Yes.
and therefore they had to do an emergency training for clinical officers, for medical assistants to become clinical officers
Okay.
and be allowed to perform emergency surgeries, cesarean sections,
Hey.
intestinal
Even
obstructions.
cesarean section.
Yes, it went on for all 4 years. Then the director of medical services, who was called Kimani, was not in favor of clinical officers doing surgery. So he stopped that course.
Okay. That was around which year?
That was 67, 68.
Okay.
And I started working from the government from 1958 on up to 1993 when I retired. I grew up from being assistant medical officer or acting medical officer, West Pokot, for 12 years when there was no medical officer to work with me.
Oh, just
as I was managing the district alone.
Managing the district, yeah.
And when we finally got a medical officer in 1976, I came back to Nakuru as provincial clinical officer.
Okay.
I went to MTC. I started my training in 1954, 1954 August.
1954.
Yeah. I graduated as a clinical officer in 1958.
58.
Yes.
1958. That's when you qualified.
Yes, that's when I qualified.
1958.
Yes.
Yeah.
I was posted to King George, the 60 Hospital.
George.
Yeah, that was now Kenyatta National Hospital.
National Hospital.
Yes.
Yeah.
Imagine.
I worked there for 6 months.
6 months. Yeah.
Then I was posted from there to Coast General Hospital. I worked there for 1 year. I worked with the doctors, whom I can see, I remember, was Dr. Moyes.
Moyes.
Dr. Moyes.
He was a white man or
A white man. 1965, there were posts. People wanted some people for anesthesia course.
Yeah, yeah. 1965.
1965. I applied for it. I went for that course. 1965 to 66.
Okay.
Now I became an anesthetist. Then 67, the end of it, I was posted to Garissa.
To Garissa.
Yep.
All the way.
Yeah.
Garissa.
During that time, Garissa was hectic during shifter war.
Yes.
I feared going there, but I worked. In Garissa, we opened a small theater.
There was never used to be a theater?
There was never used to be a theater.
So that's when you opened the theater?
Yes.
Okay.
We used a small room and we called it a theater. And then I saw we could do some emergency operations.
You are doing it with the local doctors or?
I was doing it with the flying doctors.
Or flying doctors.
Michael Wood.
Michael Wood.
Michael Wood was the one in the charge of the flying doctors by then.
Yeah.
So things like cesarean section, which I saw was complicated one, they could do operation here. I arrange, make everything ready. They came, and they did operation. Cesarean.
They come from Nairobi?
From Nairobi.
Also, you call them from Nairobi?
Yes, I call for them from Nairobi. They come and do.
With a plane?
Yeah, with a plane.
Yeah.
I used the EMO machine.
Okay.
And the operation was always successful.
Yeah.
Simple cases like a hernia, we did them there.
Yourself?
No, I was giving anesthesia and then the doctor does the operation. Hernia and appendix. We did those cases in Garissa. Then 1970, I was posted to Thika. It was when Thika was also opened.
Thika was opened in 1970.
1970. They had made a new wing in Thika. And I also made a theater there. There was no surgeon. They had only ordinary doctors who could not do operation. But then complicated cases, we called surgeons from Kenyatta National Hospital. They came and did operation.
They came by road?
Yes, they came by road. Or if they were flying, if it was urgent, they could fly to Thika. Then they did operations there. There were some surgeons like Mr. Khan was a surgeon.
Mr. Khan?
Mr. Khan, yes. Lucky enough, again, Mr. Khan was posted to Kisii. When he came to Kisii, he requested the ministry to post me to Kisii. So I was posted to Kisii because of Dr. Khan. He asked me, could I agree to go to Kisii? I said yes. So I came. 1971.
1971.
Yes, I came to Kisii. I worked. Since that time, I never went any out.
You have been in Kisii?
I was in Kisii as an anesthetist. And by then, during our time, they taught us to do extraction, teeth extractions during our
training.
Yeah, during our training. So in Kisii, I was doing dental work and anesthesia, and a clinical work in outpatient when I was free.
Okay.
But there was a group in the field who were already working called hospital assistants.
Okay.
And these people then were the one running the hospitals. They were the one in charges of the hospital immediately. The doctors after independence, like Kisang was in charge of Kabarnet. There was another one called Wakalo, who became also our teacher. Somebody who's this one who was in charge of Tana River. So these people were the one in charge of hospitals then. Then we started the course, this program, 1969 in August in Machakos, as I said, in a place called Kenya, Israel. This program was started because after independence, the doctors, there was a feel by the government that the doctors were going to, medical doctors who are the British, were going to run away from Kenya because of the government now was under black people. So they were going to run away. So the government had to think of what else will it do, who will be running these health services. So they started a short program then. They trained nurses for 1 year. Okay. Meanwhile, they started the registered medical assistant program. It was to fill that gap. And the reason was we did not have then our doctors being trained in Kenya. They were trained in Makerere. And the first lot actually of doctors joined us even that time and doing their community diagnosis in Machakos. This was the first lot who had to qualify about a year or two, about 2 years later. They joined us there, the first, and that is the first lot of 14 doctors only in Kenya to be trained. First. Okay? So then we trained, that time the program we were supposed to train for 3 years, and we moved from Machakos to Nakuru when the training now had been, the college had been built, so we went to Nakuru. And that was before we qualified, that was 1970. 70. Yeah, because immediately from there we qualified from there when the college was opened, the Nakuru MTC. Now, in 1972, a commission was started by the government to look into the civil servants, the professionals, the trainings, and even the naming of the, because everybody, every African then was an assistant. Kamunge Commission went round the hospitals in this country. They went to the lab, because we had also medical lab assistants, found a lab person in charge of the whole lab, and he was asked, what is your designation, what is your title? My title is laboratory assistant. They went to a clinical officer, was in charge of a hospital. What is your title? My title is medical assistant. Then laboratory guy was asked, how are you assisting this laboratory?
Who are you assisting?
Who are you assisting now in the laboratory? And you are alone. The medical assistant also was asked, how are you assisting the hospital? So Kamunge came up with now the title, clinical officer. There were two then cadres of clinical officers. There was the certified clinical officer. These are the people who are trained as nurses And they are now clinical officers, they were certified. Then, with us, we are being called registered clinical officer. Okay? So one time,
Direct now.
yeah, the ones who are now being trained for 3 years. We are the people who are from 4. We are the first people. I was the second group.
At the time we are starting, there are 2 types of courses for clinical officers. One was people who are originally enrolled community nurses, who are coming, who are going to MTC for a crash program for 1 year and become satisfied clinical officers.
Okay, so they were nurses and then now enrolled nurses,
And then
then going to be.
trained in MTC Nairobi for under crash program
Okay,
to become clinical officers. They were called certified clinical officers.
okay. But you entered straight into clinical medicine.
We entered
Clinical.
straight into clinical medicine, and at that time, the School of Clinical Medicine had just been started at Machakos, and by the time when we are joining, they had just built a new school in Nakuru. That school in Nakuru was built under sponsorship of Japanese people from Japan.
From Japan, okay.
And they wanted to develop into a school of tropical medicine. And that was the idea.
Who are teaching you? Who was teaching you that time in 1972? Were they clinical officers? Were they doctors?
Both, we had both clinical officers and doctors teaching. Now, when we went, there was an old clinical assistant who was teaching us, Mr. Wakalo.
Clinical assistant.
Mr. Wakalo.
Yeah.
And we also had doctors from the Provincial General Hospital. And we had also some American Peace Corps doctors who are teaching us.
Now, right from the beginning, was it the training was 3 years, or it used to be more or less?
It was 3 years, but we are told that it was a compacted curriculum, that it should have been more for 4 years, but it was compacted to 3 years.
Okay. Now, I would want to dwell a bit on the politics that happen now between, let's say, since you until the time we got to the clinical officers got to the Act of Parliament. Why were you aware of that politics that went on and how it came to be?
I would not talk much, but what I would say that there are some. We learned that there was a problem at headquarters because Mr. Gadi was at headquarters. He was
Mr.
Gadi, David Gadi. David Gadi was formerly in charge of rural health centers, but he was made to be posted in headquarters, and he was a certified clinical officer.
A certified clinical officer.
So he said, and he told us, some of us personally, that so long as he's in the office, we'll never be promoted to any grade. We shall die in that grade.
Because he was a certified and you are a clinical officer.
Yeah.
Okay.
There is something when we were in Machakos. This group, the group of the certified group, did not want us to be trained.
Okay.
They said, how do you bring people called registered medical assistants to train, and you never took us that level? So we don't want. So they fought us. We went to court.
You went to court?
Yes, we went to court. And then there was this Chief Justice, he was a Mzungu. He said it is only in London, 1937, that a group on the lower level were opposing the group which was going to train. It was only in London that such a case came up. So he threw out that. So when we came out, we were not happy with this group because they were opposing us.
Yeah. That was the case was in Machakos, or was it?
We were now in Machakos when the case, when we were still students.
Oh, and you had.
And this, no, we knew that these guys do not want us to be trained.
Yes.
So now, one day, Dr. Migwe was a director of Kenyatta MTC. He was also a lecturer on anatomy, so he came to us in Machakos. Then we asked him, where are we registered? Dr. Migwe said, I'm registered here. You are registered here in my head, because there is no register. That's Dr. Migwe. So, do you know what happened now? When we qualified, before even we qualified, we formed an association.
Okay, before you qualified?
Yes, we formed, in fact, there was already an association which was combining the two groups. The other guys who never went to Form 4.
Yeah.
These were the certified and the hospital assistant. So it was called Kenya Hospital Assistant and Medical Assistant Association, something like that. It was that one actually. So when we were qualifying now, we say no, we cannot have these people joining us. We must have us called registered registered clinical officers association. So we went to High Court. We wanted to register. No, the register of the societies.
Yeah.
So when we went there, we found that they rejected because already another association was in place. These were now of a hospital and whatever. So they say we cannot register other association because there is already an existing one, same cadre. So what we did is that we said, okay, it says that if you don't, if they beat you, what is that statement? That if you see that, you join them. So we, that statement, there is a statement there.
Yeah.
If you cannot beat them,
you can't beat them, you join them.
Join them. We told them, how much is it? It was about 2 shillings. Olo was the treasurer, the late Olo. Olo. You remember Olo of MTC?
Yeah,
he was then in MTC.
Yeah, yes.
He was the treasurer of clinical officers. That group was the treasurer. So we paid the 2 shillings and we joined that association. So now an association meeting was called for at Mbale, Mbale Rural Health Center.
Is it 88?
No, 78.
78?
Yes.
That's when you started agitating for the...
Yes. 1978. So we went to this association where now we had both cadres, the certified and the registered. That's the time when I was elected as Secretary General.
Okay, in that meeting?
In that meeting, 1978.
78?
Yes. That's the time we now started fighting. And we had a few agendas, about 5 or 4 of them. One of them was academic advancement. The second one was legal recognition. The third one was which one now?
Scheme of service.
Scheme of service.
Scheme of service.
Scheme of service. You know, there was no scheme of service, even for the doctors and all that. There was no scheme.
Then, 1980, I went in for another tropical medicine training in Britain, Liverpool. When I came, I became a trainer for medical staff, the kind of upgrading upgrading trainer at Mosorio Rural
Okay.
Training
So,
College.
Yeah, yeah.
Mhm.
Yeah,
Until I was almost retiring,
yeah.
that they called me to go to the medical headquarters
Okay.
and became a chief clinical officer.
Were you the first one, or there was others?
There were two other ahead of me, but they did not perform the work of chief clinical officer because there was no post.
Oh, okay.
So they were just there in the office. But I was the first to become a chief clinical officer,
Okay.
and it was during my time in headquarters
Yeah.
that we fought hard to get our own act for clinical officers recognition, which went to the parliament. It was passed. It was consented by the president. Now, this is where Moi now came to our aid. And that time, it was when the doctors minimized our ability of working.
Yeah.
If we were not allowed to prescribe all the drugs, they selected only very few drugs that we can only prescribe. That made the work completely impossible. And even the country, the patients suffered because the people who served the patients are the clinical officers.
Yeah.
And because of that, it's when they instructed them that clinical officers must be recognized. Therefore, allow them, open a gate for them to those bright ones who can study should be allowed to go to university and train.
Okay. Now, would it be that by that time, because there were not many clinical officers, or could you also be, as much as you are the chief, you could also be in charge, the chairman of the association, or there was another?
No. The association, the senior clinical officer called Isaac Nunda. Nunda was the chairman of the association.
Okay.
And Ole Q was his secretary. And that is when we started now meeting both the association and the Clinical Officers Council started working for the act.
Okay.
And they worked until they got the act done with the legal department.
In the ministry.
Yes. And we got our act through the parliament.
Yeah.
And got consent. I think it was 1988 is when we got the consent.
They opened a Clinical Officers Association from Homa Bay by the person called Clement Ngala. Was a clinical officer. He was a clinical officer who later on became an MP from Homa Bay.
Okay.
Yes. Unfortunately, he has died.
Okay.
So from there, I was working at the hospital, but very active in the association to work for the right of a clinical officer.
Yeah.
Because during those days, clinical officers were under nursing.
They were under nurses?
Yes.
Okay.
Nurses were administering them.
Yeah.
Then we said no. And the clinical officers, whenever he worked, if he had a clinic of himself, was taken, was being supervised by a doctor. And they paid the doctors for supervising their clinics. Yeah, so that's one I didn't like. So we wanted to have our right as clinical officers.
That is around which year now when you joined the Clinical Officers Association?
1967, I think.
67.
Yes.
But the association was already existing?
It started, I think, 1966. Yeah, it just started a few years before that. Yeah. Then from there, 67, I went on. I became a representative for Kisi. And then later on, we went until 1990. 78.
Mm.
78, I had been an organizing secretary for the clinical officers. Before that, until 1981, when I was chosen, a chairman, a national chairman for the clinical officers.
That's
1981.
81, national chairman.
Yes.
Okay.
While working in Kisii
Yeah.
as a clinical officer and anesthetist, also doing a dental work.
Yeah. But you could coordinate the whole country.
Yeah, I could coordinate the whole country.
Yeah, yeah. Now, let me ask you there, you know, it must have been quite a tough job because right now with the phones, you can keep on calling people. How did you used to mobilize people to come together?
Using telephones,
The old
the old telephone. Used to mobilize them that way. And we used to have meetings at the provincial headquarters.
That's Nakuru.
Not only Nakuru, all the provincial
All the
headquarters.
provincial headquarters.
Yeah, whenever we went there, we began provincial headquarters in Nakuru, then we could get all the clinical officers from Nyanza and Rift Valley, two people from every place.
Yeah, yeah.
So we came, then we worked, and then they saw how we were.
Yeah, yeah.
From there we went to Mombasa again, we did the same. We went to Embu, we did the same. We went to Nyeri, we did the same. Now, by going to provincial headquarters, we had mobilized all the clinical officers. We had sensitized to them. They had now known the rights of the clinical officers.
Rumors, or we hear that there was a lot of politics where maybe medical officers did not want clinical officers to
Yes.
come out, and
Yes, and
most of them fought.
And the nurses.
And one particularly, let me mention, sorry for, but we will not capture, sorry for the media, but there was one who was a PS in the Ministry of Health. Professor
Dr. Nikal.
not Libanon Nikal, later Ngai.
Yeah, we had.
Dr. Ngai?
No, I didn't work with
As a
him.
PS.
Yeah. I worked with them when they were peers. There was a big pressure.
And the Director of Medical Services?
The Director of Medical Service was Dr. Koinange,
Oh, Koinange.
who didn't want us.
Dr. Koinange.
Because-
Tell me a bit, why do you think he didn't like you?
Dr. Koinange swore within us, I will never sign an act of clinical service when I'm Director of Medical Service. He swore it.
That's what it was.
Yes.
Now, just a bit, were you in a meeting where you were, when you were saying that, or
Yes. When we were in a meeting, he said, I will not sign your act because he wanted us to be amalgamated
with the
with all cadres of clinical officers, nurses, and everything. That's why he could do. But separate clinical officers he didn't like.
Okay. So you had gone to see him?
I had gone to see him in the office.
Yeah.
He chased me from his office.
So he doesn't want to see you?
He didn't want to see me. Until when we petitioned to go to see the head of state,
Which was the Moi?
Dr. Moi.
Yeah.
We petitioned to go and see Moi. That's when he was asked. There was an act already which had been prepared to all the parliament.
Yeah.
Then it was.
Remember all of these acts?
It was.
Kibaki is the
it
one
was.
who passed it.
It was shelved.
He was shelved.
Yeah,
It
it was
Then
shelved.
we heard that it has been shelved. When we heard it has been shelved, we had to go and petition to His Excellency Moi.
Yeah.
So when we went to see him, we told him, Excellency Moi, you know the map of Kenya.
Yeah.
We showed him Loktang, Vasa Highland, those places far,
yeah.
far where doctors had not worked.
Yeah.
It was clinical officers who were working in Vasa Highland,
Yeah.
and some cottage hostels, like some cottage hostels in Rift Valley, which were being run by Kisang.
Yeah.
Eh? And everything was doing very well.
So I was a head of department in Nakuru. I invited naitwa Thairo.
No, Thairo.
Yes.
Professor
not
Thairo.
Thairo Aneda. I was looking for that.
Thairo.
Thairo, yes.
So Professor Thairo came to Nakuru. He addressed our students. Then we asked him why doctors blocking us from.
He himself was a doctor.
Yes,
Yeah, he's a doctor.
he's a doctor. And we had fought until our act, you know, we wrote the act. We went to some areas, we had meetings in Ngong, around Karen here somewhere. And the doctor said, okay, what you do, get your act, we'll put together with ours so that you can be registered under ours. So we actually amended our whatever he had drawn and we took it to them. After sometimes they rejected. This was after 10 years. 10 years fighting for that. They rejected it and they said, it went to parliament, they said it was inopportune. So we don't know that word even you can get. Inopportune. That it is inopportune. So
It's not Japanese.
no, English. It's in English. So they said the doctors will not allow clinical officers to be registered. Why? Then we said, okay, fine. Now we started taking political. We started now seeing Moi. We came and we looked for, there are so many people we used, senior government people, to see Moi. And we saw Moi, the first time we saw that one in Nakuru. Then one time I was in the ministry here, we went to State House. The minister then was the late, remember this Mkamba? So we went there, I'll remember the name, he is the late. We went there and the director was Dr. Koinange.
Okay,
And Dr. Koinange did not, he said, Bijiwe was the minister.
Mbijiwe.
So, Koinange heard that the clinical officers were going to see the president, so informed the minister. By the time these guys came, we were already in State House.
Okay.
We were already in State House.
So Koinange was a director.
He was a director of medical services and he said he will never see. He will never see a clinical officer having been registered, having their own act. But we went there. So we stood, we had our own money, little money. That time the president was being given some, you don't see, no, it was not chai, appreciation. So we had our 30,000, pharmaceutical technologies at 30, Tukuo. You remember the late, Mr. Tukuo is still alive.
Yeah, Paul.
Paul, he was the Secretary General of Pharmaceutical Technology.
Okay.
So we went to see the president. So the president talked. Now, Koinange was coming closer to Mbijiwe and told him, don't allow them to talk. I said, don't allow them. So we talked, the president talked, and normally you don't talk after the president has talked, but we talked that day. So what happened is that Tuku was the one to speak on our behalf. So the president, these other guys talked, the president talked, and then when he finished, we pushed Tuku. We are just standing, the president is here. Then he said, Your Excellency, sir, everybody almost fell down. These people hate us. These ones, they hate us and they don't want us. They have refused us. We pharmaceutical technologies, we clinical officers, we are the people working there, and these guys have refused us to be registered. You know, the president started again, and the president knows, of course, who the people. Then he said, the clinical officers, I know them. They are the people who have been treating even the white guys during colonial time. They tell them, remove the shirt, and he examines and he treats them. So who are you? At that time, these people are not even educated.
Yeah.
But these ones now are more educated than those ones. So Mbijiwe, can you bring the act to parliament so that these people are registered? But eventually then, Mbijiwe left, so we had Kibaki. Kibaki now is the one, we push him, and is the one who ensured that we got the act.
Wow. Okay. As a minister for
As a minister for health.
Okay, Mzee, I want to hear this.
When
Now,
we
you
put-
have heard that
We have seen
your
that.
act has been shelved,
Yes, then we
and
went.
then you as the chairman,
We went.
as your chairman,
Yes. We went to ask.
you mobilize the other first, or
Yes.
you went alone?
No, we went. People from every province.
Oh, the way you normally meet.
Yes, every province. We had provincial secretaries, and then during those days, we were with pharmaceutical technologies. We went there. We petitioned to him,
We went to the State House.
State House, and then it's when he asked. By then, Dr. Koinang had written some notice that we should not prescribe an antibiotic.
Okay. Okay.
So we went to petition why we could not prescribe antibiotics while anesthetists could have used many sophisticated drugs.
Yes.
And then Moi asked Koinange, where is that act which was brought to Parliament? He said, oh, it is there we shall bring. Yeah? Koinange, Mbijiwe, Mbijiwe was the minister by then. Koinange was the director of medical service, and the PS was
Bijiwe was there?
the minister.
Minister or Minister for Health.
Yes.
So they were all there.
Yes, they were all at State House. Then they were all asked to bring that pact to Parliament.
Yeah.
They agreed we shall bring it. So that act which was shelved was brought to Parliament.
Yeah.
I can't remember that the year. That's what during 80s, I can't
Yeah.
remember. So that act was brought to Parliament. As it was brought to Parliament, we canvassed the way we knew until it was passed in Parliament.
Okay.
When it was there, we canvassed.
He personally went to all members of Southerners here
All of you.
at night, and they takes him.
Whenever I was off duty,
Yeah.
I went around seeing clinical officers. Whenever I was off duty, I was around. Went to see.
Talking to clinical officers.
Yes. And then
Yeah. So when
when the bill came to Parliament, it was overwhelmingly passed.
passed. Good. Now tell me, first of all, how did you feel? You know, I can remember when it was passed. How did you get the news? Where were you when you heard that the bill has been passed?
Well, it was passed. And then
You were here in
I was in Kisii, then we heard of it.
Yeah.
Obviously, we had people who were close to State House and who could give me news. And I saw I get the news, I called my people immediately. Then this thing was passed.
Okay.
1988. That's clinical officers.
Up to the way it's written.
Yeah.
The term.
Yes.
Now, looking at that whole transition, that at one point you are the ones managing everywhere more or less,
Yes.
and then now the doctors have come in,
Yes.
and now they stop you from doing certain things
They were trying to.
to limit your
Yeah.
practice,
Practice.
your practice
Yeah.
as it were, like not prescribing
Yeah.
antibiotics.
Yeah. But-
Then how did you solve that eventually?
That one, on that very day in State House, those prescriptions were stopped. Koinange was told, forget about those things, let them work as they have been working. Don't provoke them. Because that prescription was provoking us.
Yeah.
Because we were working and then you are told not to work. Eh? If it is the person to go to get antibiotic, you ask the doctor to come and prescribe. It was a big burden.
Did you experience that yourself? That period of not being able to
No,
describe?
no.
Actually, no, me, I said no.
He
Because
came in when we had made things already.
Yeah, I just came in when food was on the table.
Well, yeah,
And you
most,
enjoyed it?
most of the clinical officers now are enjoying food.
They are enjoying food.
They don't know. They don't know how it works.
How it works. But that's why we are saying, I think, with people like you now, well, the way we highlight these stories like this, people should know where these things came from. Because maybe right now, if you meet so many people on the streets or you go to hospital, people might not know. But you're very important to this.
Only all clinical officers who are of my age know how I worked.
Yes.
The clinical officers presently do not know how it came. As Nyasende told, they said they found the food is already cooked, they are eating. They don't know how this food was cooked. But I suffered.
Yeah, it's about that. It's about that.
I've told you I never.
Though I was working here, most of the time he used to leave me here. He was to go to those Mikutanos.
Yeah.
And then he comes.
Now, I wanted to come now to the private practice part, where you were saying that initially there's this resistance that you are not supposed to work alone. Now, private practice, you mentioned that you needed someone to cover you.
Those days.
Those days, until when?
Until when the act came up.
Oh, so the act came to...
Yeah, when this one come,
Yeah, that one there.
this one. In fact, when this one come, immediately we were registered.
No, that's just something. That was just something we were writing.
We were registered everywhere now.
So the act came to really remove these things.
Yep.
Yeah.
Mm. Yes.
Since this now we are working
That is
alone.
1988.
1988.
Yeah. So you were able to go and register yourself and work.
Yeah.
But before that, which means did you get doctors to support you?
Yeah.
No.
But
Before that, yes. But since I started working here at 88, I've had no doctor to support me. I'm doing things alone. That is my license.
Okay. Over the council, yeah.
Yeah, that's a license for the council.
Doctors council, yeah.
Yeah.
Now, let me also now put it like this. Yeah, now you have come, you have gotten the act, you are working on your own.
Yes.
And when inspectors come, normally I remember they would really want to make you that you must, get permission from the medical. Were there times when you would be asked to go to the medical?
Those days before the act.
Or before the act?
But after the act, I've never seen anybody coming to oppose me being here alone.
Okay. So a lot has to do with that act, eh?
Yes.
I started working as a clinical officer in 1981. So that time the Clinical Officers Act had not gone through, despite the fact that there was a lot of struggle to get the clinical officers registered as a medical practitioner.
Yeah.
So the clinical officer was being regarded as a clerk, kind of. Whenever he prescribed, the prescription had to be taken to the medical officer to countersign before it can go to pharmacy to issue drugs. Yeah, and it was that bad.
And you did it like that?
We did.
Yeah.
Personally, I did like that.
So you take, so it's like double work.
Yeah, it's double work, yes. Somebody has got to go and check your work and see whether it's good enough, and sometimes change the prescription. But around 1988, that time we were in. I was doing my higher national diploma.
1988.
Yeah. 1988. That's when the act was discussed in Parliament. The Clinical Officers Registration and Licensing Act. We in KMTC had to suspend all our lectures for 2 days. Everybody had to go and look for your member of Parliament and convince him, let him go and support the act in Parliament.
Wow.
We didn't go to class for 2 days.
That's interesting.
And,
now, who mobilized this? Who did this mobilization?
It was internal. I don't even remember who, but it was so sensitive. It was so important. Yeah, everybody had to do something. And that time I remember Mr. Mwai Kibaki was the Minister of Health.
Okay.
And that's the first time and the last time I ever went to Parliament.
You went to Parliament?
I was there in person.
Yeah.
After convincing my MP to give support.
Yeah.
And Mwai Kibaki gave it a lot of support. He said, these people, we know them. They have been treating us, they have been treating our families for so many years. Why don't we register them? And let them continue doing the job, the good job that they are doing. And it went through.
Oh,
so from that day now, things became easier.
How was it a bit? How, when they say they have passed it, I don't know what you did at that time.
Oh, we were so happy. Yeah? Everybody in the country, all the clinic officers were very, very happy.
Okay.
It is just like the Israelites getting out of Egypt. It was a good thing.
Yes.
We felt free. It's like the bones that were tying us have been released.
Yeah.
Yes, and the people now started going into private practice. My practice license, because they came up soon after.
Yeah.
I set up a clinic almost immediately. My license was number 3, my private license.
Okay.
Yes. I set up a private clinic in a place called Kabazi in Nakuru.
Yes.
Yes, now I could practice. Yeah.
Okay. I think it was a relief.
It was a big relief, very big relief.
Yeah. Okay, so that was one of the also watershed moments that you are now free. You can run your clinics and that. Yeah. So that went on, I'm sure it must have led to many people going to the clinics and running it. Would you say that, particularly for a clinic officer who was now maybe being underpaid, I don't know whether that gave them also another lift in their spirit of...
It made a lot of difference. That time, as I told you, I was doing my higher national diploma in clinical medicine, surgery. Orthopedic surgery. I was still in KMTC teaching. So we went back to teaching after completion of the course. After a couple of years, 2-3 years, almost every clinic officer was driving a nice car. You could see the cars outside at the parking area.
For the first time?
Yes.
I'm sure for a long time that was not possible.
It was not possible. The clinic officers were doing very well. And all the ones who were in training were allowed to have a part-time licenses.
Yeah.
Yes. So when you are free, you could go to your private clinic or after work. You go and sit there and weekends. And many clinic officers now are able to build their own houses. Yeah. They buy a good car. Even living in the reasonable areas of the town. Actually, it made a lot of difference. A lot of difference.
Okay. Yeah.
Apart from, of course, assisting the patients, these clinics opened up in needy areas. Yes. The needy areas, like mine, I opened a place called Kabazi, which is 30 kilometers from Nakuru town.
Okay.
Yeah. So that community now around there, of course, they benefited. They didn't have there was no health center around there.
Okay.
So they benefited from the clinic.
No, I think it is a mutual kind of relationship.
It is. It was.
Where you now looking at that has come and the people have that. I don't know what now the next frontier. Any other kind of hurdle that came after that? I'm sure I've heard that now they really fight between doctors and some are intensified around that time.
Of course, that competition was very stiff.
Yeah.
Actually, we have clinical officers who are very good at their work. The doctor is here, has a clinic here. The clinical officer has a clinic here. Both of them are practicing clinical medicine. Because the clinic there, he cannot do operations. The main difference is major operations and anesthesia. So all of them are doing clinical. And you could see competition was very stiff. A clinical officer will do very well, better than the doctor, or sometimes the doctor could do very well, better than a clinical officer, depending on how you handle your patients. You handle them well, you treat them and they get cured very well, and your queue become longer and longer. I opened mine in a place called Free Area. Yes. I didn't fear the doctors around there. No. And I always had patients. Yes, they were there.
Okay. Oh, that's interesting.
In between,
Then we also, our practice in Kenya is backed by a law.
Yeah.
We have the Clinical Officers Act, number 20 of 2017. Previously, it used to be CAP 260 of the laws of Kenya.
So it's no longer 260, it's
Yes.
CAP 2?
Is the Clinical Officers Act, number 20 of 2017.
Now, what besides what are the real key highlights that you can say, the key differences between the CAP 260 and this new act?
The difference is that the CAP 260 used to be restrictive to our practice because it had schedules of drugs which we could prescribe. It had schedules of diseases which we could treat. But in the new they amended, they repealed, the CAP 260 was repealed, and now it has been enacted afresh. Number two, we were not empowered to do surgical invasive procedures. For example, among our cadre, we have the reproductive health clinical officers who have been trained to do to perform cesarean section. But our previous law did not allow us to perform surgical procedures like cesarean section. Then another one is that my office, this office of Chief Clinical Officer or Director Clinical of Services use also to double as a registrar. So because the two offices are very busy, we decided in the new law to separate the two offices so that there'll be an independent director and there'll be an independent registrar who will concentrate on regulatory functions of our profession.
I would want to hear from you, particularly as a word of advice and as now someone at quite a higher level of training generally. What would you give as an advice to clinical officers and medical officers and other cadres generally in this country?
The presidents right now, the president of Kenya, he has an agenda, the Big Four agenda.
Yeah.
One of them is universal healthcare.
Yeah.
We want to give healthcare to all the Kenyans, quality healthcare to all of them.
Yeah.
And I think that's where we should be heading to. We should sit as colleagues, yes, and work towards that. If at all the country is geared towards a certain very well structured objectives, we should all join hands and do what? And make it a success.
Yeah.
We should appreciate that we are working as colleagues, not as competitors. Yes, the clinical officer is not competing to become a medical officer. Medical officer has his own role, the so-called doctor. He has his own role. And particularly the general operation under, major operation under general anesthesia. That is his prerogative. Nobody's competing for that. Yes. But let the clinical officer also do his work. Yes. When we put our hands together, we shall achieve the universal healthcare in this country. Rather than try to look at a patient like he's a source of business, a source of money. Yeah.
Okay.
We should be doing that. We should work as colleagues. Yes. That does not even keep off other cadres, like the nurse, the laboratory technicians, the physiotherapy. All of us should join hands to make this universal healthcare a success. It cannot be achieved by people who are fighting and competing all the time. No. In any case, we have no shortage of patients. Patients are so many, all of us.
You can't finish them.
We don't wanna fight together. We still together we stay. Together we stay. We don't wanna fight. We don't wanna fight. Together we stay. Together we stay.
Now that you have been in this practice for some time, are there moments you can say have been good moments?
Yeah. Generally, there have been good moments.
Good moments.
And the good moments, especially when most of the time we are giving treatment and it is working. And people come to us telling us they are doing well, they are very happy. Daktari Mungu akubariki. Yes, yes.
Which means God bless you.
Yeah, God bless you. Yeah, God bless you.
Yeah. What about moments, I'm sure, like any other practice, there must have been challenges.
Yeah, I can highlight maybe situations where maybe we have given some treatment and they have reacted badly with the patient. A small child, aged about 2 years, was brought to the clinic where I was working. And then we gave treatment, and then I think it was just a bad reaction. When the child went home, she did not recover. She just continued to deteriorate. And then she had to be rushed to a bigger hospital, and we lost that child. I felt so bad. And I think she just reacted to the medicines the way we did not expect it to work. Those were many years ago. Maybe I can talk, I'm talking about some 20 years ago.
Of course, as a young person in the practice. Yeah.
Felt bad.
Now, are there any maybe lessons, like, okay, as you go along, of course, you get those kind of challenges. Do you think that they maybe depress you or they make you even better?
They make me better. They make me better because much as we are trained on proper and very meticulous history-taking techniques, most of the times we have a tendency of shortcuts. Like in any other maybe profession, some people love shortcuts. So it makes me feel that I should take history proper and even inquire about past medical history, and especially on the issues of maybe bad drug reactions. And it normally helps us a lot and moves us away from maybe dangers that would have cropped up. Yes.
Okay. Yeah. Okay, now in terms of maybe many people have cited the law as not being supportive of the clinical officer to do invasive surgeries. I don't know what gave you the confidence legally.
Yeah, when I started operating, you remember we have the anesthetists.
Yes, yeah.
The law is not favoring them.
Yes.
We had our cataract surgeons.
Yes.
The law was not favoring them.
Yeah.
They were operating.
Yeah.
So me, I used the same law the anesthetists were using to operate at that time.
Yes.
But I remember one day I went on an individual strike which really changed the events. I refused to operate in Siaya. Meaning the only medical officer could not continue operating alone. So I demanded for a document that could show that the law has allowed us to operate. And I remember Dr. Kimani wrote a letter to that effect prescribing the procedures we shall do. Until 2017, when the Clinical Officers Act was reviewed in Parliament, and we have now been allowed to operate by the law of this country.
Okay.
Yes.
Now, I don't know what you see as the future of one. One, of course, you being in the obstetrics and gynae field, but also generally, and also generally the whole cadre of clinical medicine. I don't know what you see as the future of this profession.
Of course, after the basic should not be the end. And even like me, by end of the year, I should be at least back to school, doing some other course, medical course. And clinical officers, after qualifying, they should do the specialization, and also they should do, we now have a degree, and I'm sure we are soon having the masters and even the PhD. So people should just read to improve on their skills and knowledge to manage our patients well. Yes.
Okay. Now you've also specialized in anesthesia. Yeah. What do can you say about a specialist like you now?
Yeah, a clinical officer who is a specializer, especially anesthetist, we command a lot of respect because that's a field. That's a field which is a bit unique, because a general clinical officer is of, I think, is of low cadre a bit, but as a specialist anesthetist, it is a field which is respected, because of course you have to go and review a patient. A patient is supposed to go for operation. You have to go to any post-operative review of the patient, and it is you, actually, the anesthetist. It is you who will either allow this patient to go for surgery, or you can cancel that operation. And if you cancel, even a professor cannot force you to do that operation, because I know as a clinical officer, I think you carry a lot of respect, because in surgery you are the final person.
Right now there's a movement in the world over where, because now clinical officer or the cadre similar to clinical officer is everywhere. People are coming together to form coalitions and so that they can be heard. I don't know whether you are aware of that. Or
I was not aware.
You're not aware? Yeah. I don't know how you will say about what will you say about that, because right now we have one for Africa. We have Americans have coming together. The European side is coming together. The Indian side. Yeah.
I think it's a good idea. So yes, we have a standard guideline in terms of patient management, such that I think we should have limitation. A clinical officer should have his own limitation. A nursing officer should have his own limitation. A laboratory technology technician should have his own limitation. So that prescribed job description. Because like now, in around here, go to any pharmacy around. They are treating, they are admitting patients, they are doing all sorts of work, that the work which is supposed to be done by the clinical officer. Yeah. They are even conducting even deliveries. They are even offering family planning. And I'm sorry to say, because half of the patients who go to get this family planning from the pharmacies, they end up becoming pregnant because they have not done family planning. So let's have a pharmacist should do his job as a pharmacist. A lab technician should do his job as a lab technician. A clinical officer should do his own job limitation, not to cross over. See, the problem now in Kenya, everybody is crossing over. Okay. You find a doctor, a clinical officer, sometimes he calls himself he's a doctor. You find that a general medical officer is calling himself he's a gynecologist, he's a surgeon, you see?
Okay. Thanks a lot for your time, and we hope that will inform the growth of the profession. Okay, but this one to get him on Friday, we can get him. Okay, this one again, but now I wanted the number of